Good morning, everybody. It's Dr. Bertolino from Smooth Solutions Medical Aesthetics, the head doc, and I want to pump you up. And today, ladies, we're going to talk about your head below the equator. What am I talking about? The clitoris and the female orgasm system. Oh my God, look how complex you women are. This is the female orgasm system that takes into account all the mechanical things that have to happen and all the psychological things that have to happen. God, it's tough to be a girl. So let's talk about anatomy first. And believe me, I'm learning with you guys because these things weren't taught to me when I went to school. Let's talk about the clitoris. It's a simple organ. Did you know the clitoral gland has the most amount of nerve endings in the body? I did not know that. And we are not as different between men and women. We are basically the same. The clitoral gland, of course, would be the head of the penis, which then goes into the body and forms the clitoral legs or the cura. We call it the crus in a man. This leg and this leg in a man would be the corpus cavernosa that fill with blood during an erection, but in your case, during a heightened feeling to get an orgasm. The vestibular bulbs here also have the same material as we have in the penis to fill with blood when you are starting to feel the sensation to have an orgasm. Here's the urethra, where you urinate out of, and here's the vaginal opening. Now, it's very interesting because there's a lot of blood vessels and nerve endings in here that contribute to the orgasm. You also, next, it doesn't show in this picture, you also have something called the Skene's glands that actually in some women cause a woman to ejaculate during her orgasm. And what's in the ejaculate? It's very interesting. It sounds funny, but it's interesting. Uric acid, urea creatinine, and prostate-specific antigen. So the Skene's glands, which are next to the urethra, you can't see them, are the female prostate. So let's compare it to a man's anatomy. Here is the female anatomy. Here is the clitoris, the legs, the crura, the vestibular bulbs, the vaginal orifice. Here's the penis. The vaginal or vestibular bulbs that fill with blood are the corpus spongiosum that runs along the bottom of a man's penis. This fills with blood. This fills with blood, causing the erection. And then, of course, ejaculation. This is the same makeup in the pelvis of a woman. So what am I getting to today? What we can do for you to improve orgasm. And these things are well-founded. Okay, your nervous supply goes down, your blood flow goes down. Yes, there is, just like men, a psychological component, which you guys have to understand that can be part of it. But from a mechanical point of view, it's blood flow, it's stem cells, it's platelets, it's exosomes that everybody has. So there's two ways to take care of it that we've been doing here for a while. One is the O shot. The orgasm shot, right? What does the orgasm shot do? It was developed by Charles Runnels, who is a doctor down in New Hope, Alabama. Went down to see him probably 10, 15 years ago to learn about the B shot and the O shot. It is taking platelet-rich plasma with its growth factors. And today we can do it a little bit differently with exosomes and other combinations. And it's taking those growth factors and putting it logistically in your head, your female head, which is your clitoral head, where all the nervous supply is, to reboot the nervous supply, to reboot the sensation, and to also reboot this area, of course, the clitoral legs. More blood flow, more moisture, more fun, and more sensation. What else can we do? We can do Thermiva. We have been doing Thermiva treatments here for years. I'm on my second machine. It is a well-documented procedure that with radio frequency we can stimulate blood flow in the vaginal canal and in the clitoral head, because we do it externally, to promote sensation, which promotes orgasm, and promote blood flow, which I think it's a terrific machine. Yes, these things sound scary, I understand that, but they're not that new. And we've been doing it here, and we have a big track record. We also love Thermiva for incontinence because it strengthens the pelvic floor for all you women who've had children. So there's no reason to give up the fight. The head doc wants to pump you up. He does. And this is the way we're going to do it. We're going to improve the clitoris and its function like we can improve the penis and its function. We're basically the same. We're just put together a little differently. So think about us at Smooth Solutions. We still have our 20th anniversary specials going through the holidays, and you can get a sale price on Thermiva, a Thermiva package of 3 or an O-Shot. So I guess another question would be, how do you decide which one? Well, I think if you have incontinence and a lot of issues from childbirth, then I think Thermiva is the way to go. But let's say you're a young woman, haven't had any kids, and you're still not getting that sensation that you're looking for. You're not getting that orgasm. You're not being able, if you could, to produce that ejaculate. These are all important things in sex. Then maybe a simple O-Shot, which is a one-treatment thing, can help. Now, how about doing Thermio? Do you know what that is? Combination therapy. You do 3 treatments of Thermiva, and after the 3rd treatment, that same day, you do the O-Shot to supercharge your orgasm system. Remember, it's pretty complex. So think about it. Think about us. We have sale prices through the end of December. 716-633-6100, smoothsolutionsmed.com, 5839 Main Street, Suite 102 in Williamsville. Thank you for your time this morning, and I hope you've all learned something. The head doc wants to pump you up.